Joint Action CHRODIS Plus is a 3-year initiative from 2017 to 2020 funded by the European Commission and participating organisations. The QCR Tool is a set of recommendations meant to be applied to develop, improve and assess practices, programmes, strategies and policies in various domains such as prevention, care, health promotion, education and training, and can be used for the management of any chronic condition. The QCR Tool consists of 9 recommendations that can be used to ultimately improve prevention and quality of care for people with chronic diseases. The design should clearly specify aims, objectives and methods, and rely upon relevant data, theory, context, evidence, and previous practices, including pilot studies. Using appropriate mechanisms such as self-management support, shared decision-making, education information, and active participation should promote the empowerment of the target population. The evaluation outcome should be linked to action to foster continuous learning improvement or to reshape the practice. All outcomes should be shared among relevant stakeholders. The practice should consider relevant evidence on effectiveness, quality, safety, as well as the underlying risks of the target population. Educational elements such as health literacy, self and stress management should be used to promote the empowerment of the target population. Objectives must be transparent, while potential burdens should be addressed to achieve a balance. This practice should include organisational elements, identifying the necessary actions to remove legal, managerial, financial or skill barriers in order to align staff incentives and motivation with the practice objectives. The practice should be supported by different communication techniques while defining an acceptable policy to ensure participation in the process of change. Integration with all relevant systems should enable effective linkages between all relevant decision makers and stakeholders and enhance the interaction of the target population with the relevant systems. The sustainability strategy should consider a range of contextual factors assessing the potential impact on the population targeted. The QCR Tool was developed in Joint Action CHRODIS through an extensive process and sound methodology involving more than 200 experts from a wide number of organisations across Europe and from a variety of professional backgrounds. The QCR Tool was implemented in 8 countries. Following implementation, the QCR Tool proved to be a valuable framework that triggered representatives to take new and different pathways. The QCR Tool was translated into local languages across the continent to ensure that all stakeholders felt a greater sense of ownership. Overall, the differentiating nature between the pilot countries influenced the local approach of the QCR Tool. The QCR Tool starts a valuable and practical framework that can be used by decision makers, healthcare personnel and patients to support the implementation of good practices to improve prevention and quality of care for people with chronic diseases.
people with multimorbidity and complex physical and psychosocial conditions is fragmented. The aim of integrated care is to put together all the fragments from healthcare system and from the community which already exists.
Ker vemo, da zdravstveno varstvo ne more vedno urediti vse probleme pri pacientu, smo se v okviru tega projekta tudi povezali z Centrom za socialno delo in tako uvedle mesečne sestanke, spravi skupne sestanke, na katerih obravnavamo problematiko, ki se pojavlja na terenu.
Mislim, da je pomembno, da pri zdravljenju kroničnih bolnikov nastopimo skupaj s kolegi kliničnimi specialisti, da vzdržujemo čim bolj tesno komunikacijo in da k zdravljenju pacienta nastopamo čim bolj celostno.
Ne vem dobro, odkot se je CHRODIS vzel, ampak tisto, kar se tam počne, ima veliko svetlo budočnost. Cel kup strokovnjakov in laikov pa uporabnikov bolezni si prizadevamo, da bi zdravstveni sistem, tak kot je, uporabili na najboljši možni način, predvsem v smeri boljših izidov zdravljenja.
In our pilot action, we aimed to improve the prevention and the treatment of patients with type 2 diabetes on the primary care level, taking type 2 diabetes as an example of non-communicable disease. In this context, we organized and founded the National Diabetes Center on the third level, and this center was involved for education of more than 300 physicians and nurses. Also on the primary care level, we reinforced the diabetes care units, and for diagnostics, treatment and prevention on this level. And this way of organizing was very much appreciated by the people with diabetes. One of them is present here now with us. And altogether, the QCR Tool was very useful for us because we could evaluate our strength and our weakness at any moment, redirecting our plan for the project activity.
Hello, I'm Maria Schweider from Croatian Institute of Public Health, and I'll tell you a few words about Croatian pilot. The main goal of our pilot was to improve the management of diabetes according to international standards. There are three most important outputs of our project: improved GPs' awareness and practice in diabetes monitoring, improved patients' understanding on the importance of yearly checkups, and harmonized diabetes information systems and coordination mechanisms according to international standards. We have used QCR Tool for setting up the project, and it really helped us to structure the project, but also to handle our communication with very large number of partners. Thanks to the tool, we have managed to coordinate the group work, having constantly in mind our final goal: raising awareness about the importance of regular and good quality diabetes monitoring, both among GPs and patients.
Myself, this is Professor Christos Avopoulos. I am the head of the Department of Internal Medicine. This is the first medical propedeutic department of internal medicine in the University Hospital of Achapa University Hospital of Thessaloniki. In this ward, all clinical and educational activities of CHRODIS took place. This program was a great experience both for us and patients, since we had the chance to have a more close collaboration.
Good morning, this is Dr. Dimitris Kalfanidis, Assistant Professor of Nursing. The CHRODIS Plus project was both a great opportunity and challenge for clinicians and patients alike. Lessons learned from this clinical endeavor are already being incorporated in our current practice, and thank you for this opportunity again.
I'm Funduki Antigoni, Clinical Lecturer in Nursing. Patients who participate in CHRODIS Plus program improve their skills in self-management.
Somalis, particularly women, have higher risk for type 2 diabetes. We created and piloted a culturally acceptable lifestyle intervention model to prevent type 2 diabetes among Somalis. Of the Joint Action CHRODIS Recommendations and Criteria, our special emphasis was on target population empowerment. Our pilot intervention consisted of type 2 diabetes risk identification and a group and digital lifestyle counseling lasting for 12 weeks. We conducted the intervention in the mosque in Somali with help from volunteering healthcare students from the community. The participants increased their vegetable consumption during the pilot, and they intended to continue pursuing healthier lifestyle. The piloted model proved to be feasible in providing prevention interventions to this underserved, hard-to-reach population group. Key success factor was active involvement of the target community.
That our team was supported by all stakeholders, establishing continuous information exchange.
It fostered multidisciplinary approach, incentivized those involved, and highlighted the implementation in terms of needs and common goals. The pilot indicated a positive impact on the target population. The procedure that we followed, using the QCR tool, resulted in a structured framework. Now, after finalizing the work, its significance as a facilitator in the process of implementation and successful transferability is evident.
Hello, I'm Maya Viktorova. I'm chair of Bulgarian Diabetes Association, and we were an active partner in this pilot implementation. That was an opportunity for the patient with diabetes in Bulgaria to use mHealth technology as their daily companion, stimulating better control and improving their quality of life. The used QCR tool proved to be useful in the planning phase of the pilot project and served as a good monitoring tool to support pilot implementation.
Dear CHRODISians, we are going to present the pilot study of OPACAN 7.3 on fostering quality of care and empowerment through the use of the Track Your Diabetes app in Cantabria, Spain. We start because in our region the population with diabetes is around 7%. As facilitators of the pilot study are the Chronic Care Office of the Cantabrian Health Service, the Patients Associations, and the Regional Ministry of Health. The results during the duration of the study have shown a better estimation of glucose levels, a lower frequency of measurement of those levels, and lower consumption of bread. However, it does not improve the amount of physical exercise. In the end of the study surveys of patients and healthcare professionals, the evaluation of technology as a control of empowerment system is very favorable. Global scale on the Likert scale was 75 in patients and 64 in healthcare professionals. As seen in the interview with the president of the Spanish Federation of Diabetic Patients, patient associations demand more participations.
Pues desgraciadamente no. Nosotros nos enteramos de todos estos avances en el momento que la industria nos lo presenta.
Finally, the sustainability and scalability of the program will be achieved through the School of Patients of the Government of Cantabria, thanks to the CHRODIS community on behalf of the Regional Ministry of Health of Cantabria and the rest of participants from Cantabria.
My name is Rüdiger Prüss, and together with colleagues from the University of Regensburg, in this mHealth pilot in the CHRODIS Plus, we have developed in a very broad implementation group, an interdisciplinary group, a smartphone app to increase patient empowerment of tinnitus sufferers. As you can see here, tinnitus is a chronic disorder that has been tackled here, and it is important to note that a lot of people worldwide are affected by this disorder. The mHealth app that we developed here, the most important objective was to increase the health literacy for the patients that are using it, and also we wanted to give them more control over their disease. And for us, the most important result here was that it can improve the health literacy, but on the other hand, it is not the magic weapon against tinnitus. And compared to the other mHealth pilots we did, also we see that in the other pilots we tackled diabetes. A lot of interesting results are the case. And what we also see that in general, from doing things to the patient, we move to do things with the patient. So this is also, and we collaborated with a lot of other associations here, very important point also for us. And there is a lot of things that will stay alive when the joint action, the CHRODIS Plus ends. So a lot of sustainable results in the end. And what is the main outcome for us in this endeavor, that we have to take more the perspective of tinnitus patients and go a little bit away from the researcher perspective to the patient perspective. So thanks for your attention. These are, in a very brief way, the results what we did in this mHealth action.
Thus, you and I have both been involved in CHRODIS and CHRODIS Plus, and looking back on CHRODIS Plus, for me the reflection would be whether what they aim to do was achieved. I think the key is this phrase, the focus being on tangible transnational activities with the potential to trigger health and chronic disease policies in member states with the perspective to improve health outcomes.
Indeed, but sometimes there's also beauty in the process. And the choice of having a significantly different structure in this joint action than a lot of others, where you got your feet wet, where you tried to implement things as part of the process and learn from that, has been a very huge benefit, I guess.
Yeah, I think that certainly one of the learning points was recognizing that in the planning, the aim to involve multiple stakeholders, as many stakeholders as possible, was effective and had benefits. Perhaps what could be learned from that, though, was that there might have been more stakeholder engagement in the actual planning of the project.
There might, it's a vital point, but also that is the part of when you do implementation, that it is hard. It is not a straightforward path, and when you design policies, it's very, very important to also keep an eye on the quirks and the challenges of the implementation later on.
Yes. I think you mentioned later on, one of the lessons I think that learnt is really about the march of time, if you like. that things take much longer than you might want them to. And that's the reality of implementation. It's a long-term process and will go well beyond a 3-year period, for example. The other thing maybe to learn is to recognize while patient empowerment was an important element in the guide and attention paid to it, people had very different starting points.
True. But it also is worth remembering that this is a long game. You can sometimes overestimate what you can do in 3 years, but you have a tendency to underestimate in what you can do in 10. And anyone that's been part of 2020 will know that in the course of the next 10 years, there's both a need and a huge potential to change the health and well-being of Europe.